I'm Dr. Amy Stinson, and I'll be discussing adult tonsillectomy. Your primary care physician has more than likely referred you to an ENT surgeon to discuss tonsillectomy. We do this for a variety of reasons in adults. The most common would be for chronic tonsil infections or recurrent strep throat. We also worry about impacted tonsil stones or tonsil lifts that can cause pain and bad breath. We also worry if we see lesions on your tonsils that may look abnormal, that the tonsils may be harboring a tumor or a potential cancer. These are all various reasons that we would discuss having a tonsillectomy as an adult. The surgery itself is performed in the operating room, and you'll be completely asleep during the procedure. It only takes about 20 minutes or so to remove the tonsils. Most of the time, if you're over the age of 20, you won't have a residual adenoid pad left. This is the third tonsil that sits in the very back of the nose. This is something that's commonly done in children. However, in adults, as we age, the adenoid pad regresses or gets smaller and is usually non-existent by the time we're an adult. There are always exceptions though, and if for your specific reason for tonsillectomy may include looking for the adenoid pad and removing that as well. During the procedure, everything is done through your mouth. We're able to place a gag to hold your mouth open. The tonsils are then grasped and removed with a form of cautery that seals the blood vessels as we dissect the tonsil away from the muscular tissue. After surgery, you can expect your throat to be incredibly sore. We actually expect recovery time in adults to be significantly longer than it is in children. At least 2 weeks or so of a pretty bad sore throat is what you can expect. Some people this is less, and in some people it's more. So we have to individualize treatment based on this. Your ears may bother you, and again, this is because the nerves that run through the throat go up through the ears into the brain. This makes our brain think that our ears are hurting when it's really pain that's coming from our throat. Your tongue may also feel different, and your taste may be off a little bit. This is a temporary reaction to the mouth gag that's placed during surgery. The most specific complication to the surgery that we worry about is a bleeding risk. This is a 1% risk associated with the surgery, that there may be some bleeding 7 days or so after the surgery has been completed. As the scabs that have formed in the back of the throat start to slough off, you may notice this. If you do, you need to contact your ENT to have this resolved. Once you've recovered from surgery, the chances of developing strep throat are very low. The literature states that it's anywhere from 5 to 20%, but this is still a possibility if you had your tonsils removed for chronic strep throat. So if you do have strep throat or symptoms similar to strep throat afterwards, this is still a possibility, so keep this in mind. If you had the surgery for potential tumor complications, the pathology usually takes a day or so to get back, and we'll be able to call you with those results. Patients that had the surgery for chronic tonsil lifts and halitosis, after the healing has been completed, this symptom will actually be resolved for you. In conclusion, tonsillectomy can be a very effective and safe procedure. If you have any questions regarding the procedure itself, the risks or complications, please contact your ENT for more information.